My name is Boris Lushniak. I'm the Dean of the School of Public Health here at the University of Maryland in College Park. And good afternoon to everybody, and welcome to what is our 11th Delta Omega Public Health Society, our Gamma Zeta chapter, and an important event for us every year, which is the induction ceremony. This has been occurring since we launched the school. And this is also the 9th annual recognition of Delta Omega Gamma Zeta Chapter Student Research Poster Awardees. So now we have this incredible opportunity to celebrate not only the inductees to our society, but also to recognize those who have put in the research posters. This is our second virtual induction ceremony, and our hope is that next year, if things go according to plan per the COVID-19 pandemic, and don't forget, public health message number one, if you've not got vaccinated already, get vaccinated. Number two, follow the public health recommendations. And if we do all that, we'll be able to hopefully have better times ahead of us. This really is a unique time. It's a time for us as a School of Public Health to acknowledge the fact that everyone over this past year and a half in various ways has proven both what public health is all about. It's proven the uncertainties of public health. It's proven the fact that we should have humility in everything that we approach, that we don't have the answers for everything, but also it substantiates the idea that we are, in essence, a do-good profession. At the end of all this, what do we want? We want to be able to fight the syndemics that are going on around us, be that the COVID-19 pandemic, the racial injustice, the gun violence, racism, political unrest, and climate change, and all these other things that are going on. There's a lot of activities going on this past year, some good, some really bad. But in the midst of all this, public health has come to the forefront. The visibility and the importance of public health and the importance of excellence and leadership in public health is critical. I'm going to remind you now of Delta Omega's mission, right? Because it really does entail this idea of challenges that exist around us. And the mission is to encourage and recognize excellence in practice, excellence in research, education, and academic achievement in the field of public health. And this national society was founded in 1924. We're just a few short years away from the century of Delta Omega's existence. The unique aspect of this honor society is that it not only is for students, not only for faculty, not only for alumni, but it is really a rich collective, right? It's the idea that those groups are gathered. It's students, faculty, alumni, and at times friends of public health, right? That fit into our honor society. And so all three categories, students, faculty, and alumni are there. But we also will have sort of honorary members come in who have proven the fact that they are members of our wider community. And as we nominate every year a single honorary member per chapter per year, this is important to acknowledge that public health, as CEA Winslow said a century ago, is about that continuum. I always talk about the 3 Ps, right? Promoting health and well-being, preventing disease and injury with the goal of prolonging a high quality of life. But his definition also entailed the fact that it takes a village for us to get our jobs done. And in the midst of all this, the village does include every year a single honorary member. And this honorary member possesses exceptional qualifications, has attained distinction in and devotion to the field of public health. So as we begin this program, I want to extend a special thank you to the leadership team of our chapter, Dr. Brick Saxvig, chapter president and director of communications and marketing, Dr. Kathy Sharp, who's the director of the inductee process, and Dr. Marion Moser-Jones, who's the director of research posters. And this team has aptly led the chapter for the past 3 years. I also want to thank Ms. Brielle Merchant. Brielle, hi, you're always out there behind the scenes doing incredible things, and in this case, for providing the critical support for our chapter and its activities. There's also going to be transitions, right? So this will be Dr. Kathy Sharp and Dr. Marion Moser-Jones's last year in their roles. And I just want to thank both Kathy and Marion for your commitment to Delta Omega, which has been outstanding and greatly appreciated. We all look forward to continuing to work with you in other capacities, Dr. Sharp, And Dr. Moser-Jones, it's sad, but you'll, have new challenges ahead of you as you'll take on new opportunities at The Ohio State University and working in the Midwest in that realm of public health. So we're very sad that you're leaving the School of Public Health at this point, but we wish you all the best in the new endeavors. And so this will be a major transition for us as a chapter. We're also glad that Britt will be continuing for another year as our chapter president, so we'll have some continuity. In addition, I'd like to thank Dr. Dashanka Kleiman, who's the Principal Associate Dean, my important teammate in the School of Public Health Leadership. She's advised our Delta Omega Gamma Zeta chapter, and I now welcome Dr. Kleiman to provide additional opening remarks. Here you go, Dashanka.
Thank you very much, Dean Lushniak. I am really excited for this day. It's really a day of celebration, a day of induction, and it's a visible sign of the engaged partnership that we have with our students, our faculty, our staff, our alumni, and our community partners. Our chapter, as you mentioned, was established in 2011, so this is our 11th year. And we have, as of today, 235 inducted members into the chapter. We've done a variety of things. Obviously, we have the opportunity for this annual induction, but we started also recognizing student leadership in the area of research because our predominant service activity as a chapter has been to conduct the annual student research poster competition that's been held during Public Health Research at Maryland event during the first week of April, National Public Health Week. And if you haven't had a chance to take a look, the posters are still up from this last event that we had. We had over 40 students presenting, and the poster winners for this year are up there as well. So the leadership of this particular chapter has benefited from previous presidents. For the first 4 years, we had a single president and then a team of people that would work together. So we've had Laura Wilson launch the chapter, and she was at that time the chair of the Health Services Administration Department. And then it was followed by Rachel Rosenberg Goldstein, who currently is a faculty member in the Maryland Institute of Applied Environmental Health. And she actually led as president as a student inductee. And then Caroline Mortensen and Graciela Jasek. And now this wonderful team that Dean Lushniak just highlighted, turn the corner because a team approach always is able to extend and expand the work. And I also want to add my recognition for the team's perseverance, their passion, and their commitment to public health excellence, and also to Ms. Brielle Merchant for anchoring us through this year, and to Bim and to Kelly for our communications as well. So President Saksvik, I turn it over to you for the fun part of the program.
Thank you, Dashanka. And I want to say congratulations to all of our poster awardees and our new inductees. It's very exciting, and welcome to Delta Omega. And it's really exciting to see such a diverse pool of inductees this year. And our goal moving forward is to raise and strengthen the Gamma Zeta chapter by creating opportunities for service and networking. So we look forward to the next couple of years and how we can expand. We're going to start by honoring our student poster awardees. And I want to hand this over to Dr. Marian Moser-Jones, who will acknowledge our poster awardees and give a description.
Thank you, Britt. Thank you, Dr. Saksvik. Everyone can hear me. I'm outside, and the birds of Maryland are chirping in congratulation with you. Let us start by recognizing our student research poster competition awardees. And I just want to shout out to you all and say that I appreciate everyone who submitted a poster this year, given that it was entirely virtual, and that you braved this great unknown of the virtual poster competition, as well as those who volunteered to judge. So how did we determine what were the best posters? Well, chairs conducted an internal review of their students and nominated their top student research awardees. So from the Department of Behavioral and Community Health, the 2021 Delta Omega Student Research Poster awardees are: the first place awardee was Lena Daniel, a PhD student, and this is in collaboration with her colleagues at the medical school in Baltimore. And the project title is Understanding Adolescents' Perceptions of Leadership for Health Promotion in a School Setting. Her faculty mentor was Dr. Hannah Lane. Honorary mention went to Lenora Blakely, an MPH student, and her project title was Facilitators and Challenges of Access to Housing in the Context of a Sexual and Reproductive Health Program for Youth Experiencing Homelessness. Her faculty member was Dr. Elizabeth Aparicio. And honorary mention also went to Maisha Hook, a PhD student, and her project title was Recommendations for Breast Cancer Education for African American Women Below Screening Age. Her faculty mentor was Dr. Cheryl Knott. So for the Department of Epidemiology and Biostatistics, the 2021 Delta Omega Student Research Poster awardees were: in first place, Jonathan Arum, PhD student, for the poster Self-Reported Drug and Alcohol Misuse by Disability Status in the National Survey on Drug Use and Health. His faculty mentor was Dr. Natalie Slopin. Honorary mention went to Weijun Yu for the poster Characteristics of Asymptomatic Patients, Length of Stay in Hospital, Gender Differences, and Other Attributes Among COVID-19 Carriers, a multi-center retrospective cohort study in Hong Kong. And Weijun's faculty mentor was Dr. Quinn Nguyen. Honorary mention also went to Rajrupa Ghosh and Bethany Ogbena for Obesity Phenotypes and Metabolomic Profiles, a systematic review, and their faculty mentor was Dr. Sher Dalal. So congratulations for the poster winners in epidemiology and biostats. For the Department of Family Science, the 2021 Delta Omega Student Research Poster awardees were: in first place, Rebecca Foss, a PhD student, for the poster The Effectiveness of the 14-Hour Version of the Together Relationship and Financial Education Program. Her faculty mentors were Drs. Mariana Falconier, Mark Lachovich, and Ginny Kim. And honorary mention went to Brennan Weiner for the poster Shifting Tides and Federalist Patchworks in LGBT Health Policy, Applying ILGA EU Human Rights Indices to an American Context. And Brennan's faculty mentor was Dr. Jessica Fish. Honorary mention also went to Dr. Isadora Scratchich for the poster I said doctor. I'm a little ahead of myself, but I do believe Izzy will be a doctor soon. She's a PhD candidate. And the poster was named Women's Own Experiences of How Depression Influences Fertility Desires and Contraceptive Behaviors. Her faculty mentor was Dr. Julia Steinberg. So congratulations to poster winners in family science. For the Department of Health Policy and Management, the 2021 Delta Omega Student Research Poster awardees are: the first place awardee, Portia Buchongo, for the poster Thriving in a Post-COVID Age, an international collaboration and career development tool to increase diversity and inclusion in healthcare management, health services, and health policy research. And her faculty mentor was Dr. Negin Fuladi. Honorary mention went to Marjani Sefus for the poster Evaluation of the Wellness Connections Program, Improving the Health of Individuals with Mental Diagnoses and Substance Use Disorder. And her faculty mentor was Dr. Lori Simon Razinowitz. And in the department, so congratulations to the poster winners in the Department of Health Policy and Management. In the Department of Kinesiology, the 2021 Delta Omega Student Research Poster Awardees are, in first place, Kirsten Peterman, an MA student, for the project, the poster, Will There Be a Season? The Impact of COVID-19 on Anxiety Within NCAA Student Athletes and Non-Athlete University Students. Her faculty mentor was Dr. J. Carlton Smith. Honorary mention went to Gabrielle Pena, PhD student, and for the poster, Better Indices of Sleep Quality and Quantity Relate to Lower Depression and Anxiety During the COVID-19 Pandemic. And his faculty mentor was Dr. J. Carlton Smith. Honorary mention also went to Naomi Arnold for the poster Listening to Classical Music is Associated with Lower Symptoms of Depression in Older Adults During the COVID-19 Pandemic. And her faculty mentor was again Dr. J. Carlton Smith. So congratulations to the poster awardees in kinesiology. And in the Maryland Institute of Applied Environmental Health, or MAIA, the 2021 Delta Omega Student Research Poster awardees are the first place awardee, Richard Remigio, for the poster investigating the role of clinical measures before dialysis treatment as mediators in the total association between ambient temperature and mortality, hospital admissions. And his faculty mentor was again Dr. J. Carlton Smith. Honorary mention went to Jan Michael Archer for the poster Fighting for Health and Justice in Uniontown, Alabama, Community Science Air Quality Monitoring Using Low-Cost Sensors. And Jan Michael's faculty mentor was Dr. Sakobi Wilson. Honorary mention also went to Naomi Arnold for the poster Characterization of Volatile Organic Compound, VOC, exposures among U.S. hairdressers serving an ethnic clientele. And Naomi's faculty mentor was Dr. Stephen Thomas. So moving on, and congratulations to Maya's poster winners for 2021. So moving on to public health science. The Public Health Science Program 2021 Delta Omega Student Research Poster awardees are the first place awardee, Brennan Weiner, for the poster Shifting Tides and Federalist Patchworks in LGBT Health Policy, Applying ILGA EU Human Rights Indices to an American Context. And Brennan's faculty mentor was Dr. Jessica Fish. And honorary mention went to Lenora Blakely, who is also a BS student, I should say. And the project title for Lenora's poster was Facilitators and Challenges of Access to Housing in the Context of a Sexual and Reproductive Health Program for Youth Experiencing Homelessness. And Lenora's faculty mentor was Dr. Elizabeth Aparicio. Honorary mention also went to Basilica Oroquiarja, excuse me for pronunciation of your last name, for the poster Health Literacy and Self-Management Behaviors Among Individuals with Type 2 Diabetes. Basilica, what an important poster, and your faculty mentor was Dr. Elizabeth Aparicio. So congratulations to the Public Health Science Program Delta Omega poster awardees. Now, not least, but last, the Delta Omega Leadership Committee then selected 3 of the nominees, and we had quite a lot to choose from. 2 graduate students and 1 undergraduate to go forward for the 2021 National Delta Omega Student Research Poster Competition. And this year's nominees for the 2021 APHA, American Public Health Association, Delta Omega National Student poster competition include graduate student nominees, Wei-Jun Yu for characteristics of asymptomatic patients, length of stay in hospital, gender differences, and other attributes among COVID-19 carriers, a multi-center retrospective cohort study in Hong Kong. Also, graduate student Lena Daniel for her work in collaboration with colleagues at University of Maryland, Baltimore Medical School for understanding adolescents' perceptions of leadership for health promotion in a school setting. And for undergraduates, Brennan Weiner for shifting tides and Federalist patchworks in LGBT health policy, applying ILGA EU human rights indices to an American context. So congratulations to all of you. And now I will turn it over to Dr. Saxvig for the induction of new Delta Omega Gamma Zeta members recipients.
Okay, thank you, Dr. Moser-Jones. We are truly honored today to induct everyone into the Delta Omega Gamma Zeta chapter. During our regular ceremony, if we were in person, we would be calling you all up to receive your certificate, your stole, and your pin. However, as with last year, we are going to do this virtually, as you see, and we will mail your items to you after the ceremony. We're going to begin with our 12 student inductees. The criteria for nomination of the student inductees include academic achievement, as well as leadership in public health and commitment to service. So we'll start. Our first inductee is Jan Michael Archer, who's a doctoral student in environmental health sciences. Dr. Wilson stated that Jan has been highly prepared to become an independent investigator in public health through his prior training in urban ecology, his current training as a PhD student, and his involvement with the Global Stewards Program with PI Dr. Amy Sapkota. In Dr. Wilson's lab, Jan has been an instrumental member of the team in their efforts to assess air quality in communities of color in the state of Maryland. Dr. Wilson adds that Jan has shown tremendous potential as an environmental health researcher, public health practitioner, and an environmental justice advocate. Congratulations, Jan. Our next inductee is Ivy Benjeng, a doctoral student in health services research. Dr. Chen nominated Ivy, a fourth-year doctoral student who serves as a graduate assistant in the Hospital and Public Health Interdisciplinary Research Lab, or HAPPY, and a teaching assistant and instructor for an undergraduate health policy and management course. Ivy's dissertation examines the mental health care needs during the COVID-19 pandemic. Ivy's outstanding achievement reflects her intelligence, hard work, and dedication to research, making her an ideal candidate for induction into Delta Omega. Congratulations, Ivy. Our next inductee is Abby Bridges, an MPH student in behavioral and community health. In support of Abby's induction into Delta Omega, Dr. Desmond wrote that Abby stood out from the first meeting she had with her in terms of her intellect, professionalism, and motivation, and organizational skills. In addition to maintaining her 4.0 GPA and her full-time assistantship with the department, Abby works in the Center for Health Literacy, working with Dr. Cynthia Bauer to gain additional research experience. Abby is currently completing her MPH capstone project on developing a sexual health curriculum for middle school students, and Dr. Desmond proclaims that working with her is akin to working collaboratively with a colleague rather than a student on a paper. Her work is that good. Congratulations, Abby. Andrew Conway, who's a doctoral student in family science, is our next inductee. Dr. Lewin, who has closely observed Andrew's work as a student, a teacher, a researcher, and a collaborator, says unequivocally that he is clearly among the very top doctoral students with whom she has had the pleasure of working. Dr. Lewin continues, he is extremely intelligent, thoughtful, hardworking, dedicated, diligent, collegial, and capable. He is an excellent writer and speaker who is able to think critically and communicate clearly about complex ideas. He is well respected by faculty and fellow students alike and has emerged as a quiet leader within the department. Congratulations, Andrew. Our next inductee is Free Gemaru, an MPH student in health policy analysis and evaluation. As her advisor, Dr. Boudreau states that Free is creative, passionate, and technically savvy. She's dedicated to improving the public health through generating evidence on what works and what doesn't, and communicating that evidence in a manner that policymakers can understand and use. She has demonstrated these qualities in the classroom and through applied internship experiences. She represents the best of public health at Maryland. Congratulations, Free. Our next inductee is Samantha Griffin, an MPH student in physical activity. During her 4 years as a kinesiology undergraduate student at UMD, Dr. Jete writes that Samantha was on the dean's list every semester and earned the university honor citation. Samantha was accepted to the UMD School of Public Health BSMPH Accelerated Program for fall 2019 and began taking graduate level coursework at this time. She excelled in the accelerated program, has been an exemplary student in our MPH and physical activity program, and is on track to complete her degree requirements in December 2021. Samantha is particularly passionate about gender inequality within sport and the relationship it has with physical activity levels of women and young girls. Her capstone project will explore how young women's body images influences their participation in physical activity and sport. Congratulations, Samantha. Raya Griffiths, who's an MPH student in health equity, is our next inductee. Dr. Roby avows that Raya is an amazing colleague, student, and community member. She exemplifies the type of student we want at the University of Maryland and in the field of public health in general. She is fearless, takes on challenges, and genuinely cares for her classmates, colleagues, and society. Raya is a graduate student assistant at the Maryland Public Health Fellow for the Horowitz Center for Health Literacy, supporting the state's local health improvement coalitions. Raya has contributed to the school and in the community as a teaching assistant, census outreach manager for the City of College Park, volunteer manager for the College Park Food Bank, doing grocery delivery to seniors in Columbia Heights, and interning for the Health Solutions Research. Congratulations, Raya. Our next inductee is Opia Jeffers, who's an MPH in epidemiology student. Dr. Slopin writes that Opia has impressed her course instructors and has achieved high grades in all of her courses. She is currently a research assistant for a project through Georgetown Medical School to understand the lived experiences of African-American mothers of young children, which will allow her to gain mastery of many of the epidemiological skills that she has acquired in our program. Opia holds outstanding promise for achievement and distinction within public health. Congratulations, Opia. Our next inductee is Olivia Kachengwa, a doctoral student in behavioral and community health. Dr. Aparicio writes that Olivia is a strong emerging scholar in sexual and reproductive health among African-American youth and marginalized populations, including LGBTQ+ youth, foster youth, and homeless youth. Her dissertation is among the first ever to explore African-American father-daughter communication in relation to daughters' sexual health and well-being. Olivia is also a stellar teacher and mentor. Her skill in teaching led her to being invited to design and teach courses independently within the Department of Behavioral and Community Health, including redesign for asynchronous online instruction, syllabus creation, textbook review, and teaching as both co-teacher and lead instructor while overseeing a TA. Beyond her research and teaching skills, Olivia is highly dedicated to any academic community of which she is a part. Congratulations, Olivia. Our next inductee is Sherry Macran, an MPH student in public health practice and policy. Dr. Sherry Macran is currently an MPH student as well as a full-time assistant professor of community health at Salisbury University, where she teaches drugs and public health and health communications, writes Dr. Filati. In addition, Sherry teaches the online section at SPHL 620. Sherry's motivation for earning an MPH stems from her desire to strengthen knowledge in public health. She has a diverse educational background and brings many qualities to the field of public health. She has secured over $250,000 in federal grant funding, published in peer-reviewed journals, presented at various public health conferences, and serves on the board of the Maryland Public Health Association. Furthermore, Sherry has a strong commitment to her community and spends most of her free time volunteering at organizations such as the American Cancer Society, Coastal Hospice, and the Humane Society. Congratulations, Sherry. Our next inductee is Sohil Paravan Tavita, student in the Master in Health Administration program. Sohail has been a stellar student and member of the College Park community while at the University of Maryland as an undergraduate and graduate student, writes Dr. Roby. Sohail is currently a reimbursement analyst at Adventist Healthcare in White Oak. He started the MHA without a full-time position, and after a very productive internship placement at Adventist, they recruited him to come on board as a full-time employee. Despite excelling in his role as a reimbursement analyst and being promoted this year, Sohail has also excelled in the classroom. He's a phenomenal student who will make a big difference in healthcare delivery and population health through his future career. I'm very proud of his accomplishments and know he will do great things in the future. Congratulations, Sohail. Our next inductee is Natasha Williams, a doctoral student in family science. Doctors Quinn and Fish note that Tasha is a rising star in the area of health equity research, focusing on the experiences of LGBTQ people of color. Tasha was a project manager on Dr. Fish's national research study, assessing the needs and operations of community-based organizations serving LGBTQ youth. The report from this project, with Tasha as the first author, is the first of its kind to document the unique service provisions and needs of LGBTQ youth serving community centers and programs. Tasha has produced multiple papers as first co-author through courses that she's taken and her work with the UMD PRC that reflect Tasha's beliefs in systems level change is necessary for health equity and demonstrates her interest in interrogating how macro level policy and practice initiatives are an essential unit of focus for LGBTQ health equity. Tasha has truly committed to advancing health equity through research, community engagement, service provision, and policy changes. Congratulations, Tasha. And now I'm going to congratulate all of our 12 inductees as students, and we're going to move to our faculty inductees, and Dr. Sharp will take over.
Is always an issue. Hello. Okay, here we go. Thank you, Dr. Saxfeg. Great introductions of all of our student inductees. It's such an exciting time. You all have done amazing work. So now we will move on to our faculty, which hopefully have helped mentor and guide you through your experience as a student. And we have 5 outstanding faculty inductees this year. Dr. Cruz Cano has been a faculty member in the Department of Epidemiology and Biostatistics for over 11 years and has made significant contributions to the department in the areas of research, teaching, and service. States Dr. Shin Hei, Dr. Cruz Cano has been the main statistician on many manuscripts published in public health areas such as air and water quality, foodborne diseases, and emergency medicine. As an effective teacher, Dr. Cruz Cano has taught and developed numerous courses which have served to educate hundreds of students in all areas of public health. He was essential in creating the Health Data Analysis Certificate program in our department and has served as a committee member on many capstone projects, theses, and dissertations of dozens of students across the School of Public Health. Dr. Ha adds that Dr. Cruz Cano is a productive scholar and a dedicated teacher mentor in public health who is ideal for Delta Omega induction. Our next inductee is Dr. Medane Heider. Dr. Heider's contributions reach far and wide. He helped establish our school's graduate certificate in global health and has served as a primary instructor for that program. He helped establish a unique memorandum of understanding with the Commission Officers Foundation for the Advancement of Public Health to allow those officers to complete the certificate at reduced cost. Dr. Roth, who nominated him, says he regularly receives feedback from students about the unique opportunity they have with his remarkable experience guiding them in the classroom. He is a central member of our Global Health Advisory Committee and plays a central role in the school's College Park Global Public Health program. As an instructor, mentor, and senior sage, Dr. Heider brings his unique experiences to the global health scholars and invigorates their program of study and motivates them to pursue global affairs as they continue their studies and look to the future. His unique mix of practical experience, theoretical knowledge, and extensive stories of real-world application from his career roles give students unique opportunities to engage in a world that is generally far beyond their expectations as entering freshmen. Congratulations, Dr. Heider. Our next inductee is Dr. Liz Mehring. Dr. Quinn in Family Science writes that Dr. Mehring has extensive experience with research, teaching, and practicing public health regionally and internationally. Dr. Mehring has served as the director of the Global Public Health Scholars Program since 2011. This program serves nearly 100 undergraduate students every year and guides them to explore global public health challenges and consider ways to improve individual, family, community, and population health within diverse contexts. Since 2012, Dr. Mehring has been the director of the Public Health Beyond Borders student group, leading teams of students in project-based activities in multiple locations around the world in pursuit of improving public health. She mentors graduate students who serve as senior leads for the undergraduate teams conducting community assessments, and based on listening to community voices, develops culturally appropriate health promotion programs in local villages and communities in Sierra Leone, Peru, and beyond. In addition, Dr. Mehring has led study abroad trips to India, where she maintains strong local partnerships developed while a Fulbright scholar. Congratulations, Dr. Mehring. Our next inductee is Dr. Kevin Roy, also in Family Science. Since joining the department in 2005, Dr. Quinn writes that Dr. Roy has enthusiastically embraced and actively worked to bridge divergent life course approaches in family science and public health. His research is focused on fathering, particularly with African American and Latino men, often disconnected from their families by incarceration or other dynamics. Over time, he has built trusted relationships with local and state agencies, including corrections, and his research has informed programs for reentry into society after incarceration. Recently, his focus has shifted towards mental health in the emerging field of men's health equity, specifically trauma over the life course, as well as harmful masculinities that shape health outcomes for men, women, and children. Dr. Roy has demonstrated a passion for community-engaged qualitative research that is translated into programmatic initiatives to address trauma and mental health. His work recognizes the impact of powerful social determinants such as racism and immigration practices, and engages with agencies and organizations to create programs that can positively impact mental health, adjustment to the community for returning men, and school achievement for Latino youth. Our final inductee is Dr. Kirsten Stobenow in Behavioral and Community Health. When Dr. Stobenow joined the Department of Behavioral and Community Health in 2017, Dr. Portnoy, who nominated her, writes that he was immediately impressed with her previous and continuing work in sub-Saharan Africa, particularly her work with women and HIV/AIDS. Although a junior researcher, she was steadily building her research skills and working in a difficult research area that has potential broad impact. Dr. Stobenow and Dr. Portnoy co-chair the Behavioral and Community Health Human Subjects and Research Committee, in which Dr. Stobenow has been instrumental in improving the department's research culture through state-of-the-science seminars, graduate student listening sessions, seed grants for faculty and graduate students, and most importantly, a multi-year research strategic plan for behavioral and community health. Dr. Portnoy adds that he has found Dr. Stobenow a wonderful colleague, dedicated to our students, collaborative, passionate, and committed to public health. Those are our 5 faculty inductees, and now I will hand over the virtual microphone to Marion Moser-Jones, who will discuss our alumni inductees.
Thank you, Dr. Sharp. So our alumni inductees are recognized for their engagement and work in the practice of public health that serves as a model for future graduates of our school. And we have 5 alumni inductees this year who I'm honored to present. First, in our alumni inductee category is Travis Hyams, PhD 20 in Behavioral and Community Health. And Travis' former advisor, Dr. Barbara Curbo, writes that while in his PhD program, Dr. Travis Hyams focused primarily on research questions related to colorectal cancer screening, disparities, and health literacy. He was widely known to be passionate about public health and to be someone who was supremely competent in all aspects of his work. Not only is Travis an outstanding researcher and analyst, but he is also committed to public service. During his PhD program, he completed a summer internship at the National Heart, Lung, and Blood Institute and a pre-doctoral fellowship at the National Cancer Institute. He was recently selected as a finalist for the Presidential Management Fellowship, solidifying his interest in continuing his career in public health with the federal government. So congratulations, Travis. Our second inductee in the alumni category is Dr. Lena Malayil, PhD 19 in Maya in the Maryland, in Maya. I've known Dr. Lena Malayil since she began her doctoral program in toxicology and environmental health, writes Dr. Amy Sapkota. It was immediately clear that Lena is a superb young scientist who is very passionate about gaining hands-on knowledge and experience and pushing the envelope to explore and apply new laboratory methods for the betterment of human populations, writes Dr. Sapkota. During her doctoral work, she single-handedly developed a coupled DNA labeling and sequencing approach for our lab that enabled her to distinguish between total and metabolically active bacterial communities in diverse environmental sample types ranging from non-traditional irrigation, water, and soil to produce and tobacco products. Her work from our group has resulted in 7 co-authored papers, 4 manuscripts currently under review, and another 4 manuscripts that will be submitted this spring or summer. This past year, as she has transitioned from a doctoral student to a postdoctoral fellow, and most recently to an assistant research professor in my group, Lena has taken on additional leadership roles with regard to both research and training activities. She is exceptionally dedicated to her research and mentoring and will no doubt go on to make extensive contributions applying environmental microbiology concepts and findings to positively impact the lives of vulnerable communities across the globe. Congratulations, Lena. And our third inductee is Miss Brielle Merchant, MHA. And Miss Brielle Merchant, I'm very honored to make this nomination or to announce this inductee because I've worked with her and she has demonstrated exceptional leadership and commitment to the School of Public Health's vision and activities since she joined us in 2020. With a Master in Health Administration and a BS in Community Health, Brielle has over 6 years of experience creating health and wellness programs for different audiences, including but not limited to clinical patients, individuals, older adults, employees, corporate wellness, and community residents. Before joining the university system, Brielle managed the employee wellness content and wellness communication strategy for over 42,000 employees across Johns Hopkins entities in the states of Washington, D.C., Maryland, and Florida. Additionally, she has worked with the University of Arkansas for Medical Sciences Primary Care Service Line, supporting their health care policies and data reporting. During her time at the Maryland National Capital Park and Planning Commission, she delivered wellness programming to their employees and community residents across Prince George's County. We are fortunate to have Brielle's continued leadership with her contributions to launching the Happiness and Wellness Initiative and guiding the 2021 Public Health Research at Maryland 3-day event, among other activities. Congratulations and thank you, Brielle. And our next awardee in the alumni category is Dr. Jocelyn Smith Lee, who got her PhD in 2013 from Family Science. And Dr. Jocelyn Smith Lee is an assistant professor in the Department of Human Development and Family Studies at the University of North Carolina, Greensboro. As one of our most accomplished alumni, writes Dr. Sandra Quinn, Jocelyn has emerged as a promising and innovative young scholar integrating public health and family science with a focus on men, inequality, and families. During her doctoral training, Jocelyn served as the lead research assistant with Dr. Kevin Roy, on a grant focused on the transition of young disadvantaged men to adulthood. She soon moved into her niche of cutting-edge research on trauma and loss due to violence, a topic highly relevant to the public health crisis of gun violence. Her perspective on young men's experiences is truly unique, as it emerges from her own lived experiences, her training as a clinician and therapist, her work as a policy advocate, and her development as a young scholar crafting new techniques to understand lives and affect change. Jocelyn's research and broader initiatives around homicide, bereavement, and trauma resulted in her receiving a Bill and Melinda Gates Foundation Challenge Award in 2020 for her project Dismantling Dehumanizing Narratives of Black Men in Poverty. Congratulations, Jocelyn, or Dr. Smith Lee. And our next inductee in the alumni category is Dr. Leandra Stubbs, who received her PhD in 2020 from, it says BCH in my script. Is it Health Policy and Management?
No, it's BCH.
BCH, okay. In Behavioral and Community Health. Through academic achievement, career advancement, and mentorship in the public health landscape, Dr. Stubbs has positioned herself to have a high impact and lasting career in public health, notes Dr. Barbara Kerbo. While her primary interests are in health inequities, especially concerning the prevention of HIV in Black women, her high levels of knowledge and skills transfer to many issues in disease prevention and behavioral health. She presented her work on pre-exposure prophylaxis, or PrEP, among Black women at the American Public Health Association annual meeting in 2018. And for her dissertation, she joined forces with the New York City Department of Health and Mental Hygiene to evaluate PrEP awareness among women. Today, Dr. Stubbs is a data engineering associate manager at Accenture Federal Services, where she lends her expertise in program management and budgetary guidance to a federally funded global health program. She plans to continue to expand her career in public health by encouraging the integration of behavioral, social, and political factors into financial decision-making for large public health programs. In addition to in this year's inductees, we also want to recognize one of our 2020 inductees, Dr. Priscilla Novak. As a 2019 alumna of the school, Dr. Novak is a, quote, rising superstar in the field of health services research and health policy analysis, unquote, with substantive publications in high-quality journals. She currently serves as the lead for the Agency for Healthcare Research and Quality's Accelerating Change and Transformation in Organizations and Networks contact-based research program. In addition, she teaches 2 MPH core courses. Her teaching philosophy focuses on providing students with real-world examples of challenges they will face in delivering public health services. So congratulations to Dr. Novak and to our 2021 alumni inductees. And now I will turn things back over to our esteemed leader, Dean Lushniak.
Thank you so much. And what a great induction ceremony that we had. And, you know, listening through everybody's stories, you know, this is just, it's so impressive for me as the Dean of the School of Public Health to realize that in our midst are all these great individuals, right? And, you know, to a large extent, this induction, you know, take this seriously. This is not just something that you add to your CV. This is something that comes with an obligation. It's an obligation of continuing your leadership skills and your dedication to the public health mission. So congratulations, everyone. And now let's talk about our honorary inductee this year. And I mentioned earlier about how honorary membership is part of our tradition. It's conferred upon who? Upon persons possessing, and I quote here from the rules of honorary inductees, upon persons possessing exceptional qualifications and who have attained meritorious distinction in the field of public health. And I'm pleased to announce that our 2021 honorary inductee is Dr. Carlton Green. He's the Director of Diversity Training and Education at the University of Maryland Office of Diversity and Inclusion. For more than 20 years, Dr. Carlton Green has held various roles in higher education, including in student activities and multicultural services, residence life, academic affairs, athletics, and counseling services in both public and private institutions. And while building collaborative and empowering relationships with students, faculty, and staff, he's always sought to advocate for institutional policies and programs that promote access and equity for underserved populations. Dr. Green earned his PhD in counseling psychology and received master's level training in mental health counseling and pastoral ministry from Boston College. Dr. Green's dedication to diversity and inclusion facilitated his appointment as the multicultural postdoctoral fellow in counseling and psychological services at the University of Houston, the second most racially and ethnically diverse institution in the country. While serving as a staff psychologist at the University of Maryland Counseling Center, his work was nationally recognized. He was honored with the University of Maryland Division of Student Affairs Outstanding Service Award, as well as the Champion of Our Community Award by the Lesbian, Gay, Bisexual, and Transgender Staff and Faculty Association. He was also recognized by the Association of Counseling Center Training Agencies as a 2016 Diversity Scholar, and he served as an invited keynote panelist for the 10th Biennial Natural Multicultural Conference and Summit. So welcome, Dr. Green, and I'd like for you to share a few words with us.
To the members of the University of Maryland School of Public Health, Gamma Zeta Chapter of Delta Omega, to Dean Boris Lushniak, to Dr. Dushanka Kleinman, and all of my colleagues in the School of Public Health, thank you. Thank you so much for such thoughtful and meaningful recognition, especially given the year or the past 14 months that we've all been living through. A global pandemic, which by so many accounts has disproportionately and negatively impacted minoritized people in this world, Black, Latinx, Indigenous and Asian folks, women, and LGBTQ populations, and often referred to reckoning on race, even as we continue to see harm and violence visited upon racially minoritized people and communities. Economic challenges that have been spawned by a capitalist system that has taken jobs and income from so many in the working and middle classes, even as we have witnessed dramatic economic growth for those in the upper economic categories. And of course, the exacerbation of mental health issues for so many people in our country. In this work, diversity, equity, and inclusion practitioners are often perceived as negative or unnecessarily disruptive, which often makes the work harder and slower. A natural conclusion is that folks don't generally appreciate the time, effort, and emotion invested in this work. Thank you for this. Thank you for recognizing this work. I appreciate it. And I am thrilled to share this with a team of people with whom I get to work in the Office of Diversity and Inclusion. More specifically, Jasmine Pichardo, who serves as the Assistant Director in my unit, and Adam Klager, our Graduate Assistant. I must also recognize a few others outside of my unit. Tamir Webster, who serves as the Executive Assistant to the Vice President for Diversity and Inclusion, Allison Dickinson, the ODI Communications Officer, and Ebenezer Tadele, who is our Administrative Assistant. Thank you all so much for your support of diversity training and education here at the University of Maryland. Some of you may recognize me from the anti-racism teach-in series that we started this past summer in the aftermath of the murder of George Floyd. I always opened that series by citing the work of Dr. Kamara Jones, the past president of the American Public Health Association. I cited Dr. Jones's definition of racism. She says that racism is a system. It's not a personal moral failing. It's not even a psychiatric illness. It's a system of power, and it's a system of doing two things: of structuring opportunity and of assigning value. And it does those things based upon so-called race, based on the social interpretation of how we look. And from there, I would often refer to my own definition of anti-racism. Anti-racism is behavior. Anti-racism is pursuing racial justice by naming, understanding, being accountable for, and providing remedies for the system of racial stratification that structures opportunity and assigns value. Working with these two definitions, I've spent so much of the past year on our campus and in other spaces actively trying to get people to consider how to behave differently, more courageously in the face of racism. What I know is that racism harms people physically, emotionally, cognitively, behaviorally. The author Resmaa Menakem, in his book, My Grandmother's Hand, says it this way: racism is a visceral experience. It dislodges brains, blocks airways, rips muscles, extracts organs, cracks bones, and breaks teeth. Racism is harmful, and we must commit to courageously acting when racism and white supremacy seek to endanger and destroy the lives of the people who live around us. We must consider how racism harms students, faculty, and staff of color. We must protect the lives and work of Black women, like Dr. Mia Smith Bynum in the School of Public Health, Black women who are out here in these very dangerous streets telling the truth about racism. I've learned from the Black women mentors in my life this very simple fact about racism. Racism will not go away or be dealt with effectively until white people actively participate in the pain. That can be difficult, given that none of us really likes to opt into pain. I myself am very pain averse. However, the truth is, white people have to bear the burden and hold other white people accountable, which can oftentimes be downright uncomfortable. Yet, that is the call. What are you doing to participate in the pain? What are you doing to develop your stamina to join and stay in the anti-racist fight? Last summer, I participated in a movement called Academics for Black Lives. Two Black women, Dr. Della Mosley and Paris Bellamy, her graduate student, started this effort. They wanted to provide racial education for white and non-Black educators to really understand how white and non-Black people of color educators were causing anti-Black racism in the institutions where we find ourselves. Anti-Black racism that is literally killing Black people. They also had a separate track for Black people to consider how to engage radical racial healing and hope. Dr. Della and Paris left us with a refrain that I'll continue to think about to this day. What are you doing to promote Black futures and to protect Black lives? I pose that question for everyone, white people, non-Black people of color, and even Black people, especially Black people whose response to the trauma of the racism is to be anti-Black. What are you doing in your work? What are you doing to work through your anti-Blackness? That's the message to Black people. And what are you doing to promote Black futures and to protect Black lives? Thank you.
Thank you so much, Dr. Green, and thank you to everyone who's been part of this incredible induction ceremony. To our Delta Omega leadership team, Marion and Britt and Kathy and Brielle and Dushanka, thank you so much for putting a hard work into this, what's been a transformational year for Delta Omega and specifically our chapter. To our students, our faculty, and honorary inductee, we again extend our congratulations to all. Your efforts have identified you as excellent students, faculty, community partners, alumni committed to doing public health good, and we could not be more proud at this point. To the current School of Public Health leadership and Delta Omega members attending today, we've had 60 plus people here today. That is great. Thank you for your engagement and support of these fantastic honorees, and I extend my thanks and congratulations to you as well. Due to your efforts, these honorees have enriched the School of Public Health community and beyond, and we thank you for allowing us to share in their growth. Before everyone leaves, I'm going to ask everybody to, if you can, turn your videos on because we're not in person, we'd like to have a group picture of the Zoom attendees. Please take a moment, turn on your video, smile, and join us for a group picture. Thank you all, and be safe out there.